Welcome back to Today's Health. I'm speaking today with Dr. Michael Basha about asthma. Dr. Basha, how prevalent is asthma?
Well, as I mentioned in the first section, Michelle, asthma is very common, 7% of the U.S. population, which is about 21 to 22 million people. A third of those are young kids or young adults, and the other ones are older adults. So it's a very, very common disease, and one that a lung doctor sees very commonly in the office.
How do you diagnose asthma?
Well, asthma is basically diagnosed with a good history and physical examination first. The patient will come in and we'll talk about their symptoms and do a good physical examination. And what really helps us to make the proper diagnosis are the breathing tests that we do in the office. And we do a whole range of various breathing tests depending on the patient. There's other testing that can help us, like a chest x-ray, sometimes a CAT scan, sometimes some blood tests and so forth. But primarily it's the history, the physical, and the breathing test. Sometimes we may also do some allergy testing on the patient if we think there's a strong allergic component to the disease.
So if I'm at home and I'm having some symptoms that I think might be asthma, I'm coughing sometimes where I don't have a reason for that, or starting to wheeze, how do I know when I should make an appointment with my doctor?
Well, I think if you're having continuing symptoms, chronic symptoms, which become a nuisance to you, then you really need to be seen and get it checked out. So if you were having wheezing or coughing or shortness of breath, chest tightness, those are all things which might alert you to the fact that you've got a problem, especially if there's a family history of asthma or so forth. The other thing that might sort of alert you to a problem is the fact is if you're exposed to certain triggers which aggravate the asthma or bring it on. So like, for example, if you're exercising a lot or running or something like that and you started having complaints, as I mentioned earlier, cold air around people who smoke cigarettes, perfumes, colognes, cleaning agents, those sorts of things might be triggers for the asthma, and that might alert you to the fact that you should get checked out.
Are there different levels of severity of asthma?
Yeah, we divide asthma basically into either a intermittent or a persistent form. Some patients will have intermittent asthma, meaning that they have symptoms only certain times of the year, like seasonal asthma in the springtime, for example, in relation to tree grass and weed pollen, or in the fall time from ragweed. And then other patients will have persistent asthma year-round. And then to further divide them, we divide them into people who have mild, moderate, or severe disease. So based on the history, the physical, how many exacerbations or flare-ups they have, what type of medications they need to use, how much medication they need to use, trips to the ER, hospitalizations, and so forth, that will help us classify their disease as being intermittent or persistent or mild, moderate, or severe.
What is the current common treatment for asthma?
Well, typically it depends on, of course, making the proper diagnosis, and then we will start using medications for the disease. And the medications typically include inhalers or breathing medications. These are puffers. They contain different types of chemicals. Some of them will open up the bronchial air tube. Some of them reduce mucus. Some of them reduce inflammation. They all help the patient to breathe, though.
These inhalers, are they used on a scheduled basis regularly or only when needed?
It depends on the type of asthma you have. So if you have very mild, intermittent asthma, or maybe just exercise-induced asthma, you might use a medication such as a short-acting bronchodilator just when you're having a problem, or maybe 5 or 10 minutes before exercise. And then we have those patients who have more severe persistent asthma who use a number of these different inhalers, and they use them on a regular basis.
Can asthma be cured?
Asthma really can't be cured. And now we have kids who have asthma, and by the time they become maybe 15 or 16, they sort of grow out of their disease. And they typically have a different type of asthma. We call that extrinsic allergic or atopic asthma. Adults with asthma typically will see their asthma get worse as they get older. And for most adults, their asthma cannot be cured. It can be controlled. It can be relieved when there's a flare-up, but it really cannot be actually cured.
I know that some patients are actually admitted to the hospital with asthma. What is that for, and what is done in the hospital?
Well, those are typically patients who have more severe disease. They have an acute exacerbation. They have significant symptoms of tightness and coughing and wheezing and shortness of breath. They typically end up going to the emergency room first. They receive emergency room care, blood works, x-rays. They may get some treatments in the emergency room. And despite all of that, they really don't improve, and they need to be admitted to the hospital where they receive more intensive therapy.
Now, McLaren-Port Huron has been nationally recognized as a leading hospital in the care of patients with pulmonary issues. As a medical staff member and involved with the Service Excellence team, what is done at McLaren-Port Huron to ensure that the patients are given the best care possible?
Well, myself and my partners are all board trained and board certified pulmonary and critical care doctors. So we see many of the patients here at the hospitals with lung disease, and we see almost all the patients in the intensive care unit. We really use a very standardized approach to the treatment of patients with lung disease. We rely on the standards set forth by the American Lung Association and the American Thoracic Society. We also used care plans or algorithmic approaches to the care of patients with chronic lung disease so that all patients get the state-of-the-art care that they really deserve.
Dr. Basha, this has been great information. We need to take another break. We'll continue in a moment.
Thank you.